Number 8. Ekaterina Fedeyeva. 27-year-old Russian woman Ekaterina Fedeyeva was embalmed alive in 2018 after going to the hospital for a routine operation. Instead of a saline drip, doctors mistakenly gave her the formaldehyde-based drip formalin, which is commonly used to prevent cadavers from decomposing. The substance wrought havoc on her system. For 2 days, she suffered agonizing pain and convulsions before she was placed in a medically induced coma. By spreading throughout her body, the incredibly dangerous substance would have caused inflammation, ulceration, and necrosis in the lining of all her internal organs. Unsurprisingly, she died while on life support from multiple organ failure. At first, doctors had skirted around telling Fedeyeva's mother what happened and only vaguely admitted that a medical mistake had taken place. When the details of the mix-up were finally revealed, she accused the physicians of murder and was outraged that they did nothing to amend their mistake for 14 hours post-surgery. The incident sparked a criminal investigation for negligence against the staff and hospital. Number 7. John R. Killinger Jr. On June 1st of 2017, John Killinger visited the emergency room at St. Joseph Hospital in Maine for an infection on the bottom of his right foot. The next day, an MRI was taken of his foot. Several days later, he was asked to return to see the doctor, and they discussed the need to amputate one of the toes on his right foot. After everything was set for the next day, the operation was deemed a success until they realized one crucial mistake. The operating surgeon, Dr. Darcy, had mixed up the feet and had amputated the right toe, but on the left foot. Killinger had to undergo another operation to get the correct treatment. But his nightmare still wasn't over. During his recovery, he developed an infection in his left foot and fractured all his remaining toes. It traveled up his leg, and he first lost all his left toes before getting the leg completely amputated below the knee. 2 years after that first surgery, Killinger sued the doctor and hospital for medical expenses, loss of income, pain suffering, and his now permanent impairment. Facing a negligence lawsuit, the practice admitted to performing the wrong amputation, but denied that it was the cause of his subsequent complications. Number 6. Ingolf Chuek. Once the head of urology at St. Elizabeth Hospital in Brighton, Massachusetts, Ingolf Chuek was known as a respected doctor. That is until 2019, when he was fired from his job and then arrested for killing his wife just months later. In November of that year, Chuek was forced to pay a $150,000 settlement for falsifying thousands of dollars in billings, and in December, he married 45-year-old Kathleen McLean. By January, McLean had filed a domestic abuse report claiming Chuek had thrown her to the ground, and by February, she had taken out a restraining order on him. Her reports claimed he had slammed her head and strangled her while covering her mouth and nose. However, on May the 2nd, she decided to rescind the order for the sake of her family. Just 2 weeks later, she would disappear and then turn up dead in a small pond close to their home. McLean had injuries and bruising consistent with strangulation, to which Chuek would ultimately confess. He was found by the authorities in a hotel room, and they had to revive him with Narcan after a possible opioid overdose. In the hospital, he confessed that he had strangled McLean until she passed out and panicked upon realizing she was dead, dumping her weighed-down body in the pond. Despite the confession during his arraignment, he pled not guilty, but was held without bail. Number 5. Jim Kaufman. A vivacious radio host and veteran activist, April Kaufman was at the height of a successful career when she was found dead in her New Jersey home. On May the 10th of 2012, she'd been shot twice in the chest, and it was clearly a homicide. But for 5 years, investigators came up with nothing, and the case went cold. Her husband, Jim Kaufman, a local endocrinologist, appeared to move on after her death, but April's daughter, Kim Pack, could not. As Jim remarried and set his eyes on collecting April's life insurance, Pack worked tirelessly with her attorneys to prove him guilty. After suspecting him for years, his attempt to collect April's life insurance provided her with a unique opportunity to put him in the spotlight. Pack filed a wrongful death suit against him, and for the first time, officials were given a chance to question him under oath. When asked who he thought had killed her, he speculated several answers before incriminating himself completely by telling the truth. In passing, he had mentioned it might have been a member of the pagan motorcycle gang, and the ensuing investigation revealed a sinister backstory. In 2011, April found out that Jim had been running a drug ring with the gang and was illegally selling opioids through his practice. She threatened to divorce and expose him unless it stopped, but Jim wasn't willing to give up his operation. It took a year, but with the help of the drug ringleader, Jim found a hitman amongst the pagan gang and allegedly paid him $20,000 to execute his wife. Jim, along with the ring's leader, was arrested in 2018, but his case never made it to trial. He was found dead in his cell after he'd apparently taken his own life. Number 4. Robert Ricketson. 73-year-old Arturo Iturralde went to see orthopedic doctor Robert Ricketson for corrective spine surgery. The operation included getting specially designed metal rods inserted in his back, but halfway through, Ricketson realized that they were too short. Unable to locate spare ones and unwilling to leave the minister on the table for 2 hours to get new rods, the doctor decided to use the shaft of screwdrivers he found in the operating room instead. After cutting them to size with a surgical hacksaw, he inserted them into Iturralde's back. Despite thinking he'd made a viable substitution, the stainless steel screwdrivers snapped just a couple of days post-surgery. Iturralde underwent multiple additional surgeries to correct the mistake, but he died within a week due to related complications. His family went on to sue Ricketson and the hospital for malpractice. It turned out Ricketson's medical license had been suspended in 2 other states before he moved to Hawaii. Iturralde's family won and were awarded $5.6 million in compensation. Number 3. Christopher Duntsch. Christopher Duntsch earned the notorious nickname Dr. Death for seriously harming or killing many of his patients from 2011 to 2013. Within that relatively short time frame, the neurosurgeon operated on 38 patients in the Dallas area. 31 of them were left paralyzed or gravely maimed, and 2 of them died from complications. With a degree from a good school and an impressive residency under his belt, Duntsch had the apparent background to match his overly confident demeanor. It was, however, largely unsubstantiated. Despite being a neurosurgeon resident for 5 years, he'd participated in less than 100 surgeries, while other residents averaged over 1,000. He could hide his lack of experience on paper, but not in his work. And during his very first surgery at the Baylor Plano Hospital, he left his patient with chronic back pain. It was the result of him operating in the wrong spot. He then left the patient paralyzed when they returned for a second surgery. As cases compiled, Duntsch quit before he could be fired and continued to practice, even getting a job at a hospital after he was officially reported to the U.S. Department of Health. His suspected drug use during his residency was revealed, and other veteran doctors lobbied the Texas Medical Board for months to get his license revoked, and then the district attorney's office to criminally charge him. An investigation revealed an email he'd sent about his readiness to become a cold-blooded killer, and he was sentenced to life in prison. Today's topic was requested by Guardians Animal Rescue State Certified 501c3. If you have any other topics you'd like to learn about, subscribe and let us know in the comments section below. Number 2. Jessica Santillan. In 2003, 17-year-old transplant patient Jessica Santillan received the news she'd been waiting to hear, that there was a heart and lung available for her. She underwent surgery at Duke University Hospital, but in the excitement, a grave mistake was made. Her blood type wasn't checked against the organs before the surgery, and they didn't match. The hospital tried to cover it up, but her body was rejecting the organs, and for 2 weeks, they scrambled to get a heart and lung to match her blood. Astoundingly, they succeeded, but it was too late, and she was soon pronounced brain dead. The mistake had not only cost Santillan her life, but 2 sets of organs had been wasted in the process. The transplant surgeon, who had worked with Jessica for 2 years, accepted full responsibility for the mismatched organs. A settlement for an undisclosed amount was reached between her family and the hospital. Number 1. Dr. Lawal Haruna. Boasting 25 years of experience, Senior Dr. Lawal Haruna worked for 2 years with the Sheffield Teaching Hospitals Trust before he was struck off by a disciplinary panel. In March of 2015, a woman referred to as Patient B was admitted to the hospital complaining of intense abdominal pain, which was later diagnosed as appendicitis. Haruna headed her operation, but somehow, instead of removing her injured appendix, he took out her ovary. Luckily, the patient was no longer of childbearing age, but the implications of his mistake were still significant. The doctor admitted that he had mistaken her fallopian tubes as her appendix, as they have similar worm-like structures, but dismissed the incident as a trifling error. It wasn't the first time he had made this mistake either. In 2 other botched surgeries, Haruna mistook a pad of fat as the appendix and a skin tag as a cyst. A panel eventually found him to be a danger to patients and banned him from practicing further. Thanks for watching. If you had to get stitches, would you rather they were done by a very experienced but very drunk doctor, or by a young doctor in training who has never done them before? Let us know in the comments section below.